And good morning. Today, we're going to talk about two or three things, depending on how much time we have. And so there's a lot of things in the news in the past, I don't know, I want to say about 3 months since Robert Kennedy Jr. Took over the healthcare, CDC, Health and Human Services, right? I may not be saying that right, but you know what I'm talking about. So there's a whole lot of information out there that, especially medical people, and I'm not against medical people, so I want you to hear that before I say anything else. I'm not against medical people. However, anytime you change something, they're going to have the Chicken Little approach. The sky is falling, the sky is falling. And I've seen multiple medical doctors that I know on social media decrying the fact that Robert Kennedy Jr. changed the board. It's called the Advisory Committee on Immunization Practices, ACIP. I don't know if you know, but he fired all 17 members. I think there were 17 members of that committee, and he replaced them with new people. And all of the people are just, clutching their pearls because they think that these people are not qualified. Well, they are qualified. They're medical people. They're very qualified. So I just want to go over this with you, and then we're going to segue into something else. So the new members of the CDC advisory panel, they're not all new members. Some of them have served before. So there is, let me turn my page here, Joseph Hibbing, and I may not be saying that right. He is a psychiatrist and a nutritional scientist, okay? There's Vicki Pedsworth. She is a nurse with a PhD in public health. She has served on the FDA's Vaccine and Related Biological Products Advisory Committee, right? She's on the board of the National Vaccine Information Center, which is a nonprofit, which I love them. I get a lot of information from them, so you might want to look at what they have to say. There's Michael Ross, who is a licensed physician and a former professor with a background in obstetrics and gynecology, all right? There's James Pagano. He is an ED physician with 40 years experience in the medical field. There is Robert Malone, who is a physician and a researcher. All right. He came to prominence during the COVID vaccine pandemic time because he was advocating for different things. There's Martin Koldorf, who is a Swedish biostatistician. He is a previous member of this board. All right, so he's done this before. He's also served on the Drug Safety and Risk Management Advisory Committee, so he's very, very qualified. There's Cody Meissner, who is a professor at pediatrics at Dartmouth's Giselle School of Medicine, and he also is a previous member of the ACIP from 2008 to 2012. So these people, there's another one, Retsif Levi. He's a professor of operations management at MIT. So these are not just stupid people with no qualifications. So I don't understand why the medical people are getting all upset because they changed the board. If you go back and do the research, you're going to find that there was conflict of interest with the people that were on the board. They had ties, some of them, not all of them, not saying all of them, but some of them had ties with vaccine manufacturing and with different medical firms. So we don't want to have people advising us that have conflict of interest. And so that's just one of the things that we want to look at. I'm really very, very excited that Robert Kennedy Jr. is doing the work that he's doing because I think it is very, very necessary. And I think that we're all going to be better with it. Now, the next report that I want to talk about is about current medical practices. And again, I don't want anybody to hear that I am against medicine because I am not against medicine. We are in the holistic field. We take your body and bring it back to health. We do not treat sickness and disease. That's what Western medicine attempts to do, okay, and they do it with a greater or lesser degree of success, but we're going to talk about that. And we're going to move a little bit forward on how they do it, how they used to do it, and maybe what they might want to think about doing again, okay? So medical education was once the crucible of cultivating wisdom. Students were taught to think critically, to sit with uncertainty, and to treat the human body as a whole person, not just physical symptoms, but also what do they look like, male or female, are they heavy, are they not, what is their social life, how is their marriage, all these kind of things that make us individuals. And so used to, doctors would sit with us for a while and do a big intake history, and now I don't think it's like that anymore. All right, they listened to the story. All right, and this is something that we still do today in holistic health, is we listen to your story. You're going to be telling me things that I need to know when you're telling me about your story. And so those stories that you tell me are going to help guide me onto a protocol that's going to be best suited to get your body to regain its health. Now, somewhere along the way, medical people stopped listening to the stories. Medical training has become increasingly narrow, shaped less by the complexity of the human experience and more by the clean lines of protocols and checklists. Now, whenever people ask me, they come in, they haven't seen a holistic practitioner, and they will ask me what is the difference between what I do and what the medical people do. Or they will say, I want something different. And I will ask them, do you know what the difference is? And most people have no idea what the difference is. And so I'm just going to give a little review of that so we're all on the same page, okay? So when students go to medical school, they are taught to listen to the patient, what are the symptoms, label it as a disease, and then once they label it as a disease, they go for the pharmaceutical that is going to manage that disease. Okay. In a holistic life, right, we want to know what your symptoms are for sure. And then we're going to try, with listening to your story, find out what's behind the disease so we can go for the root cause of the problem, address that root cause, and then the symptoms just disappear. So it's a little bit different. It's not a one-size-fits-all. With medical practice, certainly here in the United States, they have something called standard of care. Standard of care means don't matter who you are. If you're an adult, children are a little bit different, but all children have their own standard of care. So if you are an adult, don't care if you're heavy or not heavy, don't care if you've got comorbidities, don't care if you're male or female, right? It is standard of care. You've got these symptoms, we're going to call it this disease, we're going to give it this medication or this group of medications. Then we're going to give you other medications to solve the side effects of the first set of medications, all right? And so this is the way the Western medical model works. Used to, the medical people would listen to the stories and they could make adjustments based on their critical thinking skills. Now, there has been a corrosion of medical education, the replacement of critical judgment with algorithmic obedience. It is a slow transformation from physician to healer to technician, all right? So protocols, standardized guidelines, flow charts, and evidence-based checklists were developed to reduce errors and improve consistency, and they do have their place. But in recent years, their role has expanded from helpful reference to dominant doctrine. In a 2001 Institute of Medical report, Crossing the Quality Chasm accelerated this shift by calling for system-wide standardization to improve care quality. Since then, federal agencies such as the Preventative Services Task Force and the Centers for Medicare and Medicaid Services have embedded the guidelines deeply into clinical practice, tying them to performance metrics and reimbursement. So I just want to break that down for you. so that you can understand what we're dealing with when we're looking at the Western medical model. So we go to school, we learn about symptoms, disease, diagnosis, and medication. We get liability insurance because we don't want to hurt anybody, and no one tries to hurt anybody. But the standard of care is predicated that you're not going to get insurance coverage if you don't follow standard of care. This is why there's standard of care, and that breaks down what I just talked about in this report. And so doctors are afraid to step outside of standard of care because their insurance is going to have problems. They could get sued. There could be malpractice things, all these kind of things. And so there are people that just like to sue you for whatever. And so if a doctor follows standard of care, there's not a leg to stand on for you to sue them for malpractice, right? If they think outside the box, if they don't do standard of care, then they open themselves up for liability, and nobody wants to do that. So that is the standard of care with Medicaid, Medicare, and disease prevention risk and all that kind of thing. Well, medical education followed suit. They decided to do the same thing. In 2019, a study in academic medicine revealed more than 70% of medical school curricula now prioritizes, I didn't say that right, evidence-based protocols over clinical reasoning. Now, I do not want to go to the doctor. If I go to a medical doctor, it is because I have exhausted everything I know. My body's not responding. I need bigger guns, okay? There is a place for Western medicine, and I am all for that, all right? But when I do go to a physician, I want them to listen to my story, listen to what I've done, and to help me figure out what's missing. I don't want them just to go through the checklist, these symptoms, this disease, this medication, because that's not helping me get well. That just manages my disease. So the medical schools are not focusing on helping the students learn how to do critical thinking, what questions to ask, what kind of conclusions to come to. They're wanting them just to, they're trained to recite the steps from hypertension to sepsis algorithms, not to ask whether they make sense for that specific patient in that specific condition that's in front of them. The curriculum was once rich in uncertainty and exploration. It is increasingly dominated by clear answers to questions few have learned to ask. So there is a danger in overstandardization. It produces professionals who know how to follow instructions, but not how to think when the protocols don't work. So this is really important when we're looking at physicians and we're looking at holistic health care. We want to be able to ask the right questions, to listen to what you're telling me so that we can come to the right conclusions. So behind this evolution is a quiet but powerful web of institutional and economic forces. Both hospitals and healthcare systems are rewarded for efficiency, predictability, and compliance. The CMS merit-based incentive payment system, for example, incentivizes providers to meet guideline-based performance targets. Those who deviate may face financial penalties even if they are acting in the best interest of the patient. So let me break that down. What does that mean? Your doctor, your hospital, your medical practice is incentivized by the government that everybody is vaccinated, everybody follows the exact same procedure. Now, I have on letterhead, I don't know if I can find it today, but I have seen it, and I do have it in my possession somewhere in my office, a Blue Cross Blue Shield letterhead that states if 80% of your patient population is current on all their vaccinations, we will give you a $40,000 bonus. If 80+% of your patient population is vaccinated, then we will give you an $80,000 bonus at the end of the year. That's a lot. That's a lot. I was at a conference a few years ago It was a conference, I think it was in Dallas, but don't hold me to that. It was called The Truth About Cancer. I think it was in Dallas. And sitting behind me was a pediatrician. And we happened to go to the bathroom at the same time. And she's talking to her friend in the bathroom, and she's saying, this is really a moral dilemma for me. I know that vaccines are harmful, but I also know that that 40,000 or that 80,000 bonus could really, do my family a lot of good. And so it's really hard for me to not follow the schedule, even though I know that it's harmful to the patients. And so this is where you've got that conflict of that crisis conflict, right? Or conscious conflict is what I should say. You know what is the right thing to do, but the incentive is so high that it makes it really, really hard for you to do that. So your practice is incentivized to run so many tests, so many drugs, so many vaccines. And if you, as the doctor, are not holding up your part, they're going to fire you. They're going to reprimand you. They're going to make it uncomfortable for you because you're stopping the practice as a whole from getting that reimbursement benefit. All right. And I know this sounds mercenary and all that kind of thing. I have seen the letterhead. I know that here in the Humble area, back in 2020, when we had all that fun, that the pharmacists were incentivized, their pharmacists and pharmacy techs, whoever gave the most shots had the opportunity to win an iPad. So people were incentivized in order to follow these guidelines, whether it made sense with the person in front of them or not. And so this is something that we know does happen. I've seen the documents myself, and so I don't want to necessarily be in that circle, because I want to look at you as a human being, find out what's causing you your issues, and get that unraveled and resolved so that you can return to health. Medical schools also are not immune. According to a 2020 Association of American Medical Colleges report, 85% of U.S. medical schools receive funding tied to quality improvement initiatives. Many of these efforts measure quality in terms of protocol adherence. That means, is everybody every year getting a flu vaccine? Is everybody every year getting whatever? I mean, I'm a senior, right? And so they want me to get the flu vaccine. They want me to get the shingles vaccine. They want me to get the pneumonia vaccine. They want me to get the tetanus vaccine because it's been more than 10 years since I had one. And of course, they want you to get the COVID vaccine. Well, guess when the last time I had a vaccine? I haven't had a vaccine longer than I can remember, okay? Probably back in the day, whatever was required for school. I think in all of our life, we had like 4 vaccines. And then I know my children, they had 7 vaccines. My children did not get 7 vaccines, okay? My son had a negative reaction to the MMR DTaP vaccine. And so it probably wasn't called DTaP back in the day, okay? It was probably called MMR and diphtheria or something like that. Anyway, went to the pediatrician. The pediatrician said, don't ever give this child another vaccine. Okay, I lived in Scotland. All right, I don't know that I would have had the same advice if I had lived here in the United States, but he was born in Scotland. We lived in Scotland. I was a good mom following the vaccine schedule because that's what we're told to do, right? And so the doctor said, do not ever give this child. And I still have the paper. And I know exactly where it is, all right? It would have been detrimental for that child to get another vaccine. And so we never did. Now, my daughter, different story, never had a reaction. But even still, 7 vaccines in her lifetime. Today's children are scheduled to have 78 vaccines from birth until I think it's age 18. That is a lot of vaccination. And so one of the things that Robert F. Kennedy Jr., one of the things that he majors on and has majored on for at least the past 20 years is safety of vaccines. And this is why the medical profession is coming against him, because he's upsetting their apple cart of standardized medicine. All right. We know pediatricians, and you may be too, you may know them, that if you do not vaccinate your children at the schedule that the CDC puts out, then they will not keep you as a patient. And you know why? Because that lowers their percentage, and they're not going to get that bonus, right? It's not that they don't love you. They just love the money more. They want to have their incentives. And honestly, from a financial perspective, you just can't really blame them, although it's sad. It's sad to say. I've not ever been in that position. I would hope that my conscience is strong enough that I could walk away. But that's not something I've ever faced. And, you never know how you're going to act if you're not in that particular situation. So the medical schools are being incentivized. The faculty are under pressure to align their teachings with these expectations. So step by step, the scope for creative thought is shrinking. This model, this deviation, is seen not as discernment, but as error, okay? In the model that says everybody gets the same thing, standard of care, if you, the doctor, says, you know what, we're supposed to do X, Y, Z, but I'm going to do P and O, right? It may actually be exactly what the patient needs, but because you're not following standard of care, you're going to be penalized either financially, or you may even get kicked out of the practice if you're not doing what they want you to do. So this is really, really serious. The consequences are predictable and devastating. Clinical judgment is the core of good medicine, and it is being eroded. In a 2020 Lancet study, they found that doctors trained in protocol-heavy environments were less likely to adapt to patient-specific variables such as comorbidities or social factors. They followed the instructions even when the instructions did not fit. So what is a comorbidity? We heard this word a lot in 2020, and when people would get diagnosed with you know what, right? The statistics were that if you had comorbidities, your outcome was not going to be as positive as we would hope. So comorbidity is another disease, usually autoimmune disease, absolutely chronic disease, that would make the exacerbation of what they're treating you for even worse. So comorbidities, mainly obesity, all right? COPD, diabetes, cardiovascular issues, right, and cancer. Those are the 5 comorbidities that we're looking at. And so I don't have any of those. I'm going to go to the doctor. They're going to do whatever they're going to do. I don't have any extenuating circumstances that they need to be aware of, all right? So if you have any of those comorbidities, the doctors are trained not to factor those in, which is sad because we see this all the time. People come in with a medication list that's got 15 to 20 different medications on there. And so we run it through a software program. You can do this too if you're on a lot of medications. It's called Medscape.com. WebMD has something like that too. It's free. You don't have to be a professional. Anybody can do it. You just have to declare if you're a layperson or a professional. And then you can plug in all the names of those drugs that you're taking, and it will tell you if there's 0 interactions in the drugs, or if there's minor, or if there is significant, and I think there's even major contraindications, right? And so anybody can do this, and we do this. And so when we tell, the client sitting across the table from me, you're taking all these medications and they're fighting, you've got 15 different significant interactions. Why is that? Because the doctors are not taking those comorbidities into account. The pharmacist, I've even had people tell me, well, the pharmacist said, if I'm taking this, I shouldn't be taking this, but they're just the pharmacist. They can't not fill my prescription. So the idea is the pharmacist is telling you this. You go back to your doctor and you tell your doctor, the pharmacist said these two things should not be taken at the same time. And hopefully your doctor is going to go, oh, scratch his head, think about it, and figure out something. But maybe not so much because we see it all the time. Okay? So the consequences, we talked about that. The rigidity reduces patients to just data points. I don't want to be a data point. And I had this experience. I had an eye infection. This has been, a good 10 years ago. I don't know what happened. I went to bed fine. I got up. My eye hurt. I wear contact lenses. Did not wear the contact lens because my eye hurt, right? Put liquid silver in my eye because that's what I do. Couple days, still having problems. Husband says, you only have one set of eyes, go to the eye doctor. Okay, fine. So I go to the eye doctor and he examines my eye. He said, you've scratched your cornea. How did I do that? He goes, you got an eyelash in your eye when you were sleeping and you rubbed your eye and you scratched your cornea and that's why it hurts. Okay, fine. Sends me to the pharmacy to pick up a prescription. It's a little bitty bottle about like this, well over $100, right? So I get this prescription, and it is a steroid, and it is an antibiotic, right? Okay, don't like steroids, but my eye hurt, right? So I go and I read the patient insert. You always want to read the patient insert. The patient insert said, do not take this medication more than X times a day and more than X days in a row because you run the risk of superinfection. Super fungal infection. What does that mean? Anytime you've got a super infection, you may have heard of super bugs, right? Super bugs are antibiotic resistant bacteria, right? You should have heard about that. But if you haven't, then you can, send me an email and I'll talk to you about that. You don't want to get a super infection. Super means, I just lost one of my ears. Super means that the antibiotics that we have on hand are not going to touch the bacteria, or in my case, it was a fungal pattern. The antifungals would not touch that. And so I read the patient insert. I went back to the doctor. I did what he told me to do. It was like 5 days or 4 days. And he said, you're about 50% healed. I want you to keep doing what you're doing. I say, and he doesn't know what I do for a living, right? I say, well, I read the patient insert, and the patient insert said what I just told you. And he said, I don't care what the patient insert is. I'm the doctor, and I'm telling you to do it the way I'm telling you to do it. And I thought, and this is in my inside voice. This isn't in my outside voice. But my inside voice said, these are my eyes. I do not want to run the risk of a super fungal infection, right? I'm going to adjust the dosage to what is on the patient insert because they do the patient insert to protect themselves from liability, right? They don't want to be sued. If I take it longer than the patient insert tells me to take it, then I run the risk because I'm not doing the right thing, right? Went back to the doctor, I don't know, a couple of days later, and I was all cleared up and good to go. But I never went back to that doctor again. Why? Because he didn't listen to me. He didn't hear what I was saying. He had reduced me to data points. I'm not a data point, okay? I'm a human being. I have a brain. I can read. I can do critical thinking, and I expect my physician to do the same, all right? So the fallout, right, consider the fallout. There are strict, very, very strict opioid standards and guidelines, all right? This is meant to curb abuse. And yes, we do need to curb abuse. It is meant to curb overuse. And yes, we need guidelines for these. However, the protocol, the standard of care, has also led to undertreatment of chronic pain. This is noted in a 2021 Journal of Pain study. The checklist said no, so doctors, fearing the professional risk, withheld that help from those patients that needed it, all right? Equally alarming is what is happening to empathy. Empathy is trying to put yourself in the other person's shoes, all right? You can have sympathy. I'm sorry that happened to you. But empathy is trying to put yourself in that shoe. I was a widow. My husband died in 1998. I know what it feels to be a widow. So I can definitely be very empathetic with a widow because I have felt that. I know what that feels like. I cannot do the same thing with losing a child. I have not lost a child. So I can be sympathetic to that, but not empathetic. I can't put myself in that place. I can think how tragic it would be, but until that happens to you, you really can't. So in a 2018 Journal of American Medical Association study confirmed what many know intuitively. Empathy improves health outcomes, yet empathy cannot be easily standardized, coded, or reimbursed, so it becomes a sideline. So from all of this, what do I want you to take away? I want you to take away that the new Vaccine Advisory Board is made up of professionals, medical professionals. Most of them are doctors. Okay, some of them are professors. Some of them have served on the board before. So all of these people that he has picked are very, very competent. Now, I think one of the criteria of what he chose is they did not or could not have any conflict of interest with pharmaceutical companies. And I applaud that. Okay, I applaud that. If somebody pays me money to offer a certain product, right, I'm just going to be more likely to do that because of the financial incentive, right? That doesn't happen in holistic world. It just doesn't. And so that's not something that my people ever have to worry about. But you need to ask if your doctor is doing standard of care. You need to have in your mind, am I just a data point for his reimbursement, or is he thinking about my best interests at heart? Because obviously, if we're sick, we need help. We don't know everything, right? And so we hope the doctors can figure out what's going on so that we can get the benefit that we need. And so I'm not bashing doctors, not at all. It is a different mindset. As a conscious human, I need to understand the filters that they're filtering through so I can know if that aligns with what my objectives are as far as preserving my health. So that's a lot. That was a whole lot. If you have any questions, let me know. If you found this helpful, let me know. Like, share, comment, because all of that helps with the algorithms and all that kind of thing. So I will see you. What is today? Today's July. No holidays coming up. I will see you next Friday. Have a great weekend. Relax, recover, rejuvenate, and rest.